So after every extraction, we do definitely recommend a bone graft. So picture there's a big hole, right? And there's a big hole. Now, if we do not put a bone graft in, a bone graft basically fills the empty hole so that you don't have any bone loss. When we do not do a bone loss, you will end up with about 30 to 40% of bone being shrunk around the tooth side. So the bone walls will go like this. The wall will go in. Now, to prevent the bone loss, we typically definitely recommend a bone graft being placed. Bone graft will basically mean we pack the extraction site with bone all the way to the top. At that point, a lot of time we will draw your blood, and that's called PRF. That helps with healing quite substantially. So what we'll do is we'll draw blood, we're gonna spin it in our centrifuge, and then that's gonna concentrate the white blood cells and platelets, which we're gonna put on top of the bone graft. After that, we put a cover over the top of that, which is made of a medical piece of Gore-Tex. That's gonna keep the bone happy while it's protecting the bone from outside food and saliva and all that. Over the top of that, we're gonna put some sutures on the top of that. Now, how the post-op works is at your first visit when you get the procedure done, we're gonna prescribe you quite a few medications, right? It could be ibuprofen, Tylenol, steroid, antibiotic, and most likely a pain med if you need it. We're gonna book you out 2 weeks later. At that point, we're going to be removing the sutures in 90% of cases. 10% of the time, we do like it to solidify a little bit longer before we do remove the sutures. Now, when you're looking in there, you'll still see that membrane. It's a white cover. That white cover is going to protect the bone graft, and we usually take it out around the 4-week mark. At that point, it's actually a really quick and easy appointment. All we do is do a quick pluck, and it's out of there. It does sound scary, right? It's not. It's less worse than having a splinter removed or having the baby tooth taken out. So after the 4-week mark, you're going to notice that the tissue is still a little bit inflamed, so you're not going to want to eat anything too hard, like chips, right? Chips could just kind of poke the tissue and it's going to hurt, so just guard it for another few weeks. After the 10-week mark, for the most part, the bone's going to be very, very stable. That's when we recommend you to come back. We're going to take a new x-ray, and then we can measure for the implant placement itself, or if you want to wait a little bit longer, you can wait a little bit longer, or at that point, if we're going to be doing a bridge or a partial over the top of that.